Hello, my name is Charles Goldfarb, and I'm joined by my co-host Alexander Aleem for the AOA podcast Lessons in Orthopedic Leadership. We continue to host a variety of guests and will continue to tackle topics of interest to all leaders, but especially those in orthopedic surgery. Each episode will welcome a guest with expertise in a crucial leadership area. Today, we will discuss the upcoming AOA Annual Meeting with one of our outstanding symposium moderators. Doug Lundy, who has been a previous guest on the podcast, is welcome back as he has developed and will lead Symposium number 1 in Salt Lake City. Welcome, Dr. Lundy.
Hey, y'all. Thank you very much for inviting me.
Doug, great to have you back again. Excited to kind of see this. So the title of the symposium is The Changing Environment and Dynamic of Healthcare. Maybe give us a kind of a 1-minute elevator pitch about what this is about and sort of how you came to put the symposium together.
Yeah, thanks, Alexander. So this symposium is intended to look at the super high levels of where healthcare is going, perhaps in the next 5-10 years or even further, as much as anybody can ever predict that, in terms of the big disruptive forces that we see going on in the market. So what we want to do is look at the things really at the very high end of healthcare delivery that all affect us every single day that we work. What are those things? What's going on with them? How do we understand them better? How do they impact us in orthopedic surgery? And of course, these things are somewhat way over our heads, but to what effect or to what extent can we affect them?
That is perfect. And it sounds like a topic which will be of interest to all of us. Can you give us a couple of examples of what those high-level issues are, just to engage the listeners and hopefully have them come to this symposium?
Yeah, sure. So there are things that, of course, the pandemic made very clear to us, and we have 2 of those that we're really specifically addressing within this. I know everybody's sick of COVID by this point, but COVID showed us about workforce shortages. That was absolutely dramatic with the workforce, especially during the Great Resignation after the pandemic. And also another thing the pandemic displayed out for us were supply chain issues that, prior to this were really just an academic discussion in MBA classes about, supply chain could be affected by this, that, and the other thing. And we always seem to find workarounds for it. But then suddenly during the pandemic, there were no workarounds. There were none of these issues that could be easily solved. So those are 2 of the things we're discussing. We're also discussing the effect and the influence of private equity. There's good and not so good things about private equity. We'll tap on that. And then also about market consolidation, because market consolidation continues to dramatically affect healthcare. And so we feel that these 4 issues are the big issues that affect us every day, whether you're affected by private equity or not. You are, whether you know it or not, and whether you're affected by market consolidation or not, you are. And so we're going to show everybody how these are relevant and how they impact every single person, both in private practice, hospital employment, and in academic surgery.
Love that. I mean, I think that hits on a lot of the major issues that we all are facing. Like you said, post-pandemic became very, very real. All-star group of panelists. Can you tell us how you chose them and what each of them are going to bring to the table?
Yeah, my pleasure. So first off, we have David Jevsevar, who so he did the exact opposite of what I did. I was in private practice in a large practice, and then I went to academic surgery, and David went the other way. He was chair at Dartmouth, and now he's chief executive officer of Ortho Virginia, one of the largest private practice groups in America. So David knows a tremendous amount about market consolidation and those sort of things. So he's clearly an expert that can talk about those things. My very good friend, Scott Porter, who I've known for many years, who's at Prisma Healthcare. Many people know Scott. He's such a dynamic and really, really smart fellow, is going to talk about supply chain issues. Scott got his MBA, and he's an expert at many business things, and so he can easily discuss these things. And then we were looking around for somebody who was really a key and an expert for workforce and things like that. And fortunately, through our contacts, we were very, very fortunate to have Thomas Miller, who is a physician and the chief medical officer at the University of Utah. Dr. Miller is actually an internist, but not only is he local to the AOA meeting, but he's an expert in this. At the University of Utah, he has been instrumental with significant workforce issues there. And I spoken about private equity before. My previous group was purchased by private equity. And so we feel like we can really cover these topics well. Our goal is to quickly hit the high points on these and then encourage the very diverse and broad group of the audience to discuss these on the open mic so we can get a full feeling of what's going on across the country.
That is fantastic. And to your point, the plan is for 60 minutes of presentation and 30 minutes of Q&A. So those who are listening to this podcast in advance of the meeting, we want you to bring your questions. And we have a really talented group of experts who will be there to respond. So thank you for this teaser. I think mission accomplished. It sounds fantastic. And we really look forward to symposium number 1, which is on Thursday, June 15th at 8 a.m. sharp. Be there.
Thanks a lot, y'all. Looking forward to it.
Thanks, Doug. It's going to be great. I was going to say 8 a.m. is not super early for most of us orthopedic surgeons, especially mountain time. So no excuse to not be there. We'll be plenty caffeinated up and ready to listen to have a great discussion.